Hi, I'm Ashwini Namasivayam-MacDonald. I am a speech-language pathologist and director of the Aging Swallow Research Lab. In this video, we will be talking to both a caregiver of someone with dementia who had dysphagia and a head and neck cancer survivor who lives with dysphagia to get their insights and perspectives. We will also see how dysphagia is assessed and what you can expect from the gold standard assessment, a videofluoroscopy or swallowing x-ray. Lastly, we'll talk about what the next steps are if you are diagnosed with dysphagia or if you think you have dysphagia. Dysphagia means difficulty swallowing foods, liquids, or medications. It can start from the point that the food, liquid, or medication enters your mouth to the point that it enters your stomach. When we think about dysphagia, we think about two main things. We think about swallowing safety and we think about swallowing efficiency. Swallowing safety means protecting the airway and the lungs during the swallow, meaning that we don't want any food, liquids, or medications entering the airway. This helps us avoid aspiration pneumonia. When we think about swallowing efficiency, we think about how timely the swallow is, or how well the food moves through the throat during the swallow. Ideally, we don't want any residue left behind. Typically, a swallowing evaluation starts with a clinical swallowing assessment. This happens before we get to the radiology suite. A speech-language pathologist will ask questions about the swallow, when the swallowing impairment started, how long it has been going on for, if it's been getting better or worse. We will also look at the function of the muscles and nerves in the head and neck to see how they are working. After the clinical swallowing evaluation, if the speech-language pathologist needs more information to form a management plan, they may request a videofluoroscopic swallowing study. Next, let's review how a swallowing assessment is conducted. You will see a videofluoroscopic swallowing assessment, an X-ray swallow video. During a videofluoroscopic swallowing assessment, you go into a radiology suite. Here, you'll find a radiology technician and a speech-language pathologist. The radiology technician turns the equipment on and off. The speech-language pathologist will direct the patient on what to swallow and when to swallow. The patient is given different stimuli, food and liquid mixed with barium. Barium is a substance that we can see on X-ray. This allows us to see how the food or liquid is moving through the mouth, the throat, and the esophagus into the stomach during swallowing. The X-ray also allows us to see how the body is responding to the food or liquid moving through it. Next, we will turn to David, a head and neck cancer survivor who lives with dysphagia.
I'm Dave Jameson. I am a head and neck cancer patient. 4 years ago, I had a tumor removed from my left tonsil and several lymph nodes and my base of tongue. Today, I both have cancer and I live with dysphagia. I noticed I was having trouble swallowing about 24 hours after I had head and neck cancer surgery. I was asked by one of the nurses to take a sip of water, and it was difficult. It was unlike any sort of pain that I'd ever experienced. And what I noticed in the days to follow, and now what has turned into the years that follow, is that the swallowing for me is problematic. I sometimes choke. I was first told that I had dysphagia about a year and a bit after my surgery. In the early days, there was a lot of pain, and I think a lot of that was residual from the surgery itself. The worst parts of my day living with dysphagia are breakfast, lunch, and dinner, because those three moments in my day require me to make a decision on what I can ingest safely. I also need to know that I'm in a comfortable place, both in my environment, and if I am with people, which is rare that I eat in the company of others, I have to ensure that they understand that I have dysphagia and at any moment I could choke. What did I know about dysphagia before my cancer treatment? Absolutely nothing. I'd never heard of it. I didn't know what a base of tongue was. I was an absolute newbie in terms of my condition. So dysphagia, I still have to spell it for people, and even after I've spelled it for people, they still don't understand. So I have been learning on the fly, living with this condition. I wish I knew at the time of diagnosis that dysphagia, over and above cancer, was a condition that I would have to manage and live with for the rest of my life. I had no concept that this was going to profoundly affect me in the way it has.
Next, let's meet Malene. She was a caregiver to her mother who lived with dementia and dysphagia.
My name is Malene Stewart, and I was a caregiver for my mom for 4+ years following her diagnosis of Alzheimer's and dysphagia. My mom was diagnosed with major neurocognitive disorder in December of 2019. We made the decision as a family to care for her at home, and we noticed through the trajectory of her disease and the dementia that her swallowing difficulties also increased. So the first signs that my mother had dysphagia was her weight loss. We noticed that she was losing a lot of weight. I noticed that she would often cough when she was swallowing liquids. What was it like to care for my mom with dysphagia? It was extremely challenging. I am a caregiver. I'm also a mother of 4 children. And so what I found myself was having to cook sometimes 2 different meals, or cooking a meal and modifying her meal so that she was able to swallow and enjoy the food. It was also quite difficult to sit down as a family at mealtime, because my attention and my concern, if there was not a PSW or personal support worker present, was just ensuring that she was safe during her meal times. I didn't know anything about dysphagia before my mom's diagnosis. I wish I knew about the various tools and supports that are available for people living with dysphagia. I wish I knew about the different utensils, the cups that we could have used to help my mom to be independent longer during her disease progression. Getting my mom's swallowing assessed by a speech and language pathologist was helpful because it opened up the doors for more resources for us once we established that she had swallowing difficulties and had dysphagia. Because I was able to then understand the mechanics of swallowing, so that it empowered me to be able to advocate for my mom for what she needed. Your loved one can live independently. There is support out there. This is not the end. This is just new beginnings, and it is something that you will get through with the support of your medical team and your community. One message that I love to give to others if they're concerned about their loved one swallowing is to reach out to their family doctor, get connected to a speech and language pathologist that can support you with the tools and the resources that you need to help support your emotional journey and your loved one's journey through dysphagia.
The message I'd like to give to people who have difficulty swallowing is this: there is support out there for you. It can feel very lonely, and you think that I'm the only one with this condition. That isn't the case. Help is out there. You have to reach out. You do have to do the work to find it, but it's worth that journey, and you can get help along the way to improve things. It might be slight, it might be significant, but you can improve your life living with dysphagia.
As David and Malene have shared, dysphagia can affect our physical health, our emotional well-being, and our ability to socialize with others. If you or a loved one have dysphagia or have any difficulty swallowing, the best thing you can do is get support early on. There are also lots of resources online. You can find them on our lab website. There, you'll also find a link to our dysphagia support group, a support group for patients and caregivers of people living with dysphagia in Canada.